How are you feeling today? We hope you're well, because today we're talking all about diseases and illnesses. You'll learn how to talk about not being well. Welcome to...
Aprender inglés con Reza y Craig.
Are you okay, Reza?
Sorry, I might be ill, Craig. I think I'm ill. I've got a terrible cough. No, hold on. That's better.
Hello, I'm Craig.
And I'm Reza.
And if you're a new listener to the podcast, welcome. With over 45 years of teaching English between us, Reza and I are going to help you grow your grammar, vocalize your vocabulary, and perfect your pronunciation, taking all aspects of your English to the next level. How are you, Reza?
Well, I think I've got rid of that tickly cough.
You sounded terrible.
Yeah. Yes. I hope I'm not ill, but sometimes you just get that little feeling at the back of your throat, like someone tickling you. To tickle is dar cosquillas. It's not a tickly cough, but I think I'll survive.
How are your allergies this week?
Funny you should say that. Actually, I do feel quite allergic to the pollen. In other words, my hay fever is quite active today.
Well, I'm sorry to hear that. This podcast is all about diseases and illnesses. We're going to look at some vocabulary connected to that topic. But first, a voice message from our friend Marcos from Argentina, who is a long-time listener of the podcast, but he hasn't been in touch for a while. So it's really nice to hear from Marcos.
Hey Reza, hey Craig, this is Marcos from Argentina. Well, it's been a while since I sent you a message. I have been busy, but well, now I just to talk to you about my way to listen and to improve my English. Well, I spend 20 or 40 minutes every day listening to podcasts like ours, or also Lux English podcast and Real Life Global. Also, I like this podcast. Also, watch series in English with subtitles, but now I can watch just audio, original audio. Well, that's all. Bye bye.
Well, thank you very much for your message. It's really good to hear from you, Marcos, and good to hear that you're listening to English so much, 30 or 40 minutes a day. That's fantastic. Well done. And you're doing everything right. You're listening and you're practicing your speaking by sending voice messages. Any comments, Reza?
Thanks very much for your message, Marcos. All I can say is keep doing it. Keep listening to the podcast and keep sending us your messages. We love to receive them.
There is one little thing, Marcos. When you do speak, you use the word well a lot. You could use well to give yourself some time to think what you're going to say next. That's fine, but don't overuse it. Try not to use it too much. You could also use the word so. You could use the word anyway. So try to vary those filler words, the words that you're filling in before you say your next thing, and that will help you to sound a little more varied and a little more fluent.
Craig, we have more feedback. We have this time an email from another loyal listener. That's Ronnie Morfin from Mexico, who's doing very well and taking a business psychology degree and also going to a French Congress in Mexico City in October.
That's right. I'm not going to actually read her email. I just wanted to say hello and say that she sent us an email. It was really good to hear from her. Good luck with the degree. And I think you're probably back from your Congress in Mexico City, Ronnie. So I hope it went well, and please keep in touch.
Yeah, a very interesting topic, business psychology these days.
Yeah, I wonder what she's learning. I wonder what business psychology involves. That sounds very interesting. Speaking of emails, Reza, we have another one from our friend Gustavo Gonzalo. And this is what Gustavo wrote. I would like you to take into consideration the possibility of talking more deeply about other more serious diseases. And Gustavo lists some: cancer, heart attack, AIDS, which is SIDA in Spanish, Alzheimer's, Parkinson's, multiple sclerosis, ALS, which I hadn't heard of, and depression. And he was interested in learning some vocabulary related to treatments of these diseases. Thank you very much for your suggestion, Gustavo. Now, we have spoken about health before, haven't we, Reza? Do you remember what we spoke about and on which episodes?
Actually, I seem to remember in a couple of different episodes, we did one specifically about alternative medicine. So not the typical things that traditional doctors do, but things like homeopathy, acupuncture, all of that. Mm-hmm. That was in episode 126. So to refresh your memory, or if it's the first time you're going to listen to it, go to inglespodcast.com/126. But Craig, I think we also did an episode about going to the doctor, didn't we?
Yeah, we spoke about going to the doctor, basic things, perhaps when you're traveling and you want to describe illnesses and things that are affecting you, getting sick, describing pain, and all of that vocabulary can be found at inglespodcast.com/107.
And if you listen to that episode and you're a doctor, we apologize in advance. We couldn't resist putting in a few doctor jokes in that previous episode.
That's right. So on this episode today, we're going to expand a little on that basic vocabulary and give you something more in depth, which means deeper. So diseases. Now, there are different words which are kind of synonyms to describe diseases. One of those is malady, which, if you look at it, it's probably easy to remember if you're a Spanish speaker because it looks like mal, which is bad. Malady. It's similar in French, isn't it?
Yeah. I think maladie exists in French, doesn't it? Yeah.
What are the others, Reza?
Well, some other common words are ailment. Not ill, but AIL, ailment. Ailment. A slightly more old-fashioned word, but it's still used today. It's similar to illness. Sickness is another common one. I'm sure you'll know. Can you think, Craig, of a more uncommon one?
We can use the word disorder, which is order with the prefix dis. Disorder, which is trastorno in Spanish. A disorder. I have a disorder. It's very general, isn't it? You could specify by putting a word before that. I have a breathing disorder. I have a lung disorder. I have a heart disorder. So you could specify it by putting a word before it.
For me, that sounds the most formal of all.
Yes. Or you could just say, I have a health problem. If you don't want to speak about specifics, if you don't want to, maybe it's too personal, you don't want to get into the specifics of your ailment or disease, you could say, I wasn't working last month, I had a health problem. Or I won't be available next week, I have a health problem. And then you don't have to specify exactly what it is.
Now, Craig, people often are unsure whether to use the word illness or disease. And sometimes either seems okay. Can you give us any advice about when to use the word illness and when to use the word disease?
Yes, there's a quote that goes like this. A patient goes to the doctor with an illness and goes home with a disease. And the idea behind that sentence is that an illness is what you personally feel. You feel ill. That's really your physical condition or maybe mental condition. But when you go to the doctor and the doctor diagnoses your illness, then he puts like a label on it. So it becomes something more medical, more of a disease. Although sometimes the words are interchangeable.
Another thing about disease, which makes it different to the words sickness or illness, is that it's usually only for serious or long-term health problems. So, for example, if you have a flu, la gripe, that is not a disease. No one considers that a disease because it's usually not too serious and it doesn't last a long time. So la gripe, flu, is not a disease. So a disease can be something very serious, which maybe doesn't last a long time, but it's very serious. Like you become very ill, and if they don't treat you in 5 days, you're going to die. That could be a disease, yeah. Or it could be something which doesn't really give you a lot of trouble, but it lasts a long time. For example, you could have, let's say, arthritis, or which makes your bones feel uncomfortable from time to time, or eczema, which isn't going to give you a lot of trouble in your life, but it's going to last a long time. That's a disease. So not things that we all get that come and go. They're not diseases. Of course, we've got another word which is very commonly used instead of those two, which is the word sickness. Sickness just means medical problems, but as understood from society's perspective. So it's not a very medical, not a very technical word. It's a very general word, sickness. Sick, of course, is an adjective, and then sickness is the noun.
And when you get married, you make a very, very strong promise, which is called a vow, VOW. So you vow to love your partner in sickness and in health.
As we said earlier, the word illness is very common. Illness tends to be used more for what the patient personally feels. So it's quite common for a person to say, yes, I have an illness which troubles me. The patient personally feels that. It's not so common for the patient to say, I have a sickness. Now, that would be more from the society point of view. But when you talk about yourself, you say, I have an illness, generally.
So is it possible to have a disease without feeling ill?
Good question. What do you think?
I think you probably could if you weren't aware of it. Say, for example, you had cancer, but
Right.
there were no symptoms.
Of course.
You have a disease, but you don't feel bad yet. Eventually, you probably will, but there's no symptoms. You're okay, but you have that disease. And maybe that's true with malaria, because malaria, I think you get attacks. You get malaria attacks when you feel really, really sick. But when it's not active, then you've got the disease, but you don't feel bad. You don't feel sick.
Yeah, and funny you should mention that. Funny you should mention that is a colloquial way of saying, well, because you've mentioned something, it's reminded me of something I've heard recently. Funny you should mention that. I heard on the news recently, I don't want to frighten people in Spain, but I'm sure a lot of people have heard the news, that there have been a few cases in Spain, and I think in other parts of Europe as well recently, of people contracting, that means to get a disease, get an illness, contracting malaria in Spain. You heard
Really?
me right. Yep.
Which area?
They don't know for sure, but probably the Mediterranean coastal area. So I'm not talking about people who were in, let's say, Mozambique or India and got malaria and came back. That's happened before, although not a lot. But even more unusual, there have been mosquitoes which have bitten people in Spain, and in Spain they got malaria. They've proven this, They've carried out tests that have conclusively proven this. And not only mosquitoes giving malaria, but also a thing called dengue fever.
I've heard of that.
That has also been contracted by a few people in Spain. Now, this is a very new phenomenon.
Would I blame the mosquito immigration laws? I think the immigration laws for mosquitoes should be made tighter.
Yes, yeah.
On the border, the border control, when the mosquitoes come in from abroad, they should stop them on the border and make sure they've got a visa.
Yeah, maybe carry out a blood test on them.
Yeah. So that brings us to the point of the difference between an acute disease and a chronic disease. Now, you mentioned arthritis. Would you describe that as an acute disease, a chronic disease, and what's the difference?
Definitely a chronic disease. I can say since I have it, I feel I know what I'm talking about. I've had arthritis since I was about 16 years old. It has caused me a couple of problems from time to time, but it's not usually acute. It's not severe and sudden. It doesn't surprise me. I know I have it. It's a chronic disease. It develops over a long period of time. It seems to get perhaps a little bit worse with the years, but there are times when it doesn't seem to get much worse for a couple of years. It's chronic.
And I have a acute disease. That makes me laugh when I say acute disease, because acute disease sounds like a cute disease, like a cute teddy bear. Que teddy bear más mono? Cute, C-U-T-E means mono, or no sé, bonito. No, it's not. I have bronchitis, which is a acute disease. Now, you can have chronic disease, which means it's pretty permanent and it stays with you. What I get are quite severe and sudden attacks of bronchitis. Usually when I catch a cold, it goes to my chest, and then the bronchitis develops and lasts for about 3 weeks. So it's acute disease. It's very severe and very sudden, and then it goes away. It disappears.
Would you say it's a common disease? Do many people have bronchitis?
It's fairly common. It's fairly common, and it tends to develop. I'm not a smoker, but it's common among smokers, especially when they get older. It's something my brother-in-law has as well sometimes. Also, people who suffer from asthma can get bronchitis. So it's an inflammation of the bronchial cords.
Would you say it's a serious disease?
When I get an attack, it completely disabilitates me. To disabilitate you means you can't do anything. You just have to sit and rest and wait for it to go away. Yes, there's medication. You can take antibiotics, but when I move, I start coughing. If I lay down on the bed, I start coughing. I often have to sleep in the chair sometimes, which is really uncomfortable, sleeping in a chair, because I have to stay upright. And luckily, I haven't had an attack for about 4 years. But of course, everybody gets different levels of attacks, and some cases are more serious than others.
Can it lead to death? Like heart disease or liver disease. So some serious diseases can lead to death if you're not careful. Can bronchitis lead to death?
I guess it could, because the bronchial cords expand, and to an extent where it's difficult to get the air through to your lungs. So I guess that if they are too inflamed, you stop breathing. I guess. I haven't heard of anyone dying from an attack, but I'm sure when it gets very bad and you're hospitalized, if they can't open up your bronchial cords, then I suppose in theory you could die. Again, we're not doctors, so don't take any of this advice.
Yeah, please don't change your medical lifestyle based on what we say, you know.
Disclaimer, we are not doctors and we are not giving medical advice here.
Craig, do you know how you got bronchitis? Is it an infectious disease or a contagious disease? What's the difference?
An infectious disease is, according to my dictionary definition, a living organism that enters the host, the body, and replicates inside them, causing disease. So it goes inside your body and it replicates, it multiplies, it gets bigger and bigger and bigger. That's infectious, an infection. And contagious spreads from one person to the next through direct contact, like zombies. So not all communicable diseases are contagious. If you've got malaria, you can't pass it to somebody by touching them. But if you're a zombie and you bite someone, then that's contagious and you could die. Can you think of an example of a contagious disease?
Contagious disease?
Flu?
The flu, yeah. You can get it from one person if a person saliva or from their mucus. You can be infected by it as well. Of course, there have been contagious diseases in the past which have been a grave threat to humanity, such as the plague, la plaga, the Black Plague. That clearly was a contagious disease. You only had to touch someone or maybe even just breathe in the same air as them and you suddenly had that disease. So some contagious diseases can spread very, very quickly.
AIDS is an example of a sexually transmitted disease, or it could be transmitted by syringes, by needles. If you use a syringe that a person with AIDS has used and then you pass it on to somebody else. So it's common if you're a drug addict and you use a syringe that's been infected by HIV, then you could pass it on. Obviously, sexual intercourse, you could pass it on that way as well.
Craig, if you're a bit worried you're ill, and I hope you're not from listening to all this.
What's the name of someone who's worried that they're constantly ill?
Someone like Woody Allen in his films, something like that. He's hypochondriac.
That's right.
Yeah, he's always worrying about his health. Oh, is that my nose? I'm feeling itchy. Have I got a cold? And my leg feels funny. Has a mosquito bitten me? Without having any proof, you're a hypochondriac. Are you hypochondriac at all?
No, I don't think so. A hypochondriac is constantly worried and concerned that they're going to die. They've got a serious disease and they go to the doctors more than necessary. They go to the doctors for medical checkups, which is important. You should go to the doctor from time to time to get a checkup. A checkup is revision medica.
So, Craig, if you are unlucky, if you're not fully well, there are many ways you can say the fact that you're not well. Can you list a couple for us?
Oh, yes, there are many synonyms, similar ways to say the same thing. To be sick, to be ill, I-double-L, I'm ill. To fall ill, you can fall ill with something. You can be in poor health. The adjective poor, obviously the opposite of rich. If your health is poor, then you are not well. You're feeling poorly. Can you think of any more?
Oh, yes, there are more. To be in bad shape. It's a more informal one. To be under the weather is a colloquial expression.
Bajo el tiempo. Don't translate that literally. Or in bad shape. Mala forma.
Yeah, not literal. To be poor plus ly. It doesn't mean you're poor that you don't have money. It means you're not feeling well. To be poorly. You can catch something. So you catch a specific thing. You catch an illness. That means you get it from somewhere. Or if you've already got some kind of illness or disease, then you suffer from something. For example, Craig suffers from bronchitis. I suffer from arthritis.
I suffer from having a teacher's salary.
Yes, and believe me, we do suffer. And the last one I can think of is to go down with something. Again, that's quite informal, using a phrasal verb, go down with. If you go down with something, that means you fall ill probably quickly, the idea of quickly, with something you've just got recently. So you can go down with the flu, la gripe, very quickly. You can be feeling fine 1 minute and, about an hour or two later, you need to be in bed.
When was the last time you went down with something? When was the last time you felt poorly?
About 2 or 3 months ago. 2 months ago, I think. Over the summer, yes, I got some kind of stomach bug. B-U-G. A bug is like un bicho. So it's a very general way of saying something that shouldn't have been in my stomach somehow got in. And I had a terrible night's sleep. And the next day I couldn't eat at all. And I just couldn't stop vomiting and going to the toilet. Don't know what it is. I decided to wait for a day before going to the doctors. And after about a day, it had cleared. So I didn't bother to go to the doctors because it had gone. And I thought, well, he's only going to tell me what I had, but now I'm better. So I'll never know what it was. All I know is I went down with something. I had a bug. It lasted about a day and a half. And then I was okay again. That was over the summer.
So you went down with something, which is a phrasal verb, and you got over it quite quickly. We can use the phrasal verb to get over in the meaning of recover. So Reza got over the stomach bug in 24 hours?
More or less, or a day and a half, yeah.
So in spoken English, it's probably more common to use that phrasal verb to get over, meaning to recover, than actually use the verb recover.
Now, some people sometimes say they're ill, but they're not ill. And a useful collocation to express that is to feign illness. That's F-E-I-G-N, to feign illness. That means pretend, so you're acting, it's not true. To pretend to be ill or sick, it's not real. Craig, have you ever feigned illness?
I'm sure I have, although it's been a long time that I feigned illness so as not to go to work.
Maybe when you were a kid, not to go to school?
Yeah, when I was a kid, probably I feigned illness. There's a phrasal verb that's useful as well, to put it on. Obviously, you can put clothes on, you can put shoes on, put glasses on. But if you put it on, you can use that in a similar way to say to feign illness. Like, you're not really sick, Reza. You're putting it on. You're fooling me. You're not really sick. You're just putting it on.
Craig, are there any drugs or medicines that you have a reaction to? Any drugs, medications you cannot take?
I'm not allergic to anything that I know of, but I have in the past taken malaria tablets when I've traveled to Asia or Africa, and I've had a bad reaction to the tablets and the pills because my stomach was bad, or it didn't agree with me. You can say that medication doesn't agree with you. That means it doesn't agree with your body. It doesn't go well with your body. So yeah, I've taken tablets that didn't agree with me. What about you?
Yes. Sorry if anyone related to the company is listening right now, but Frenadol, that famous Spanish medication, which seems
It's very effective.
very mild, but it brings me out in a rash.
Really?
A rash is when your skin it becomes red and heated, doesn't feel normal. Frenadol, strangely enough, and I've taken much, 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 much stronger medication because of arthritis I've had, but Frenadol doesn't agree with me, strangely enough.
Does it make you lose consciousness? Do you faint when you take it?
No, I wouldn't say that. It only gives me a rash. That's all. But quite an acute rash.
How do you say rash in Spanish? Una erupción. So to faint is when you completely lose consciousness, when you pass out and you are unconscious and you don't know what's happening. It's like you're sleeping for a while, and then eventually you hopefully regain consciousness. You become conscious again.
But if there's something wrong with you, there's plenty of things that doctors or medical practitioners can do. So don't get too depressed. They could run tests. That's an interesting collocation. Run. Yeah. Run tests. Or you can say do tests or carry out tests. They're all the same meaning. For example, blood tests, x-rays, biopsies, etc.
And it's very common for the doctor to take your blood pressure. And often confuses me because in Spanish you say tensión de sangre. And that's like a tension. It reminds me in English, but it's not. It's pressure, which are similar words, but in English, it's blood pressure. Be careful of the pronunciation of blood. The vowel sound is a. So not blood, but blood. Your blood pressure. To take someone's blood pressure or take their pulse to get their heart rate. How many beats per minute?
Once tests have been carried out, that might help the doctors to rule something out. That's why they do tests, to rule something out. The phrasal verb rule out means to deduce that you don't have a certain condition through tests, or maybe just considering your symptoms, what you've got. So the first thing you do is say, well, this is what you haven't got. We can rule that out. And then let's keep trying till we discover what you do have.
And then they hopefully can give you a diagnosis and tell you what's wrong with you. And the next step, of course, looking on the positive side, is to treat you. Now, there are lots of synonyms on ways that you could express this in English. To treat someone's illness, T-R-E-A-T, to cure someone's disease. Are there more, Reza?
To heal someone, and also an expression which the patient says rather than the doctor. So the doctor could say, I'm going to treat you, I'm going to cure you, I'm going to heal you, but the patient is on the mend. So you can say as the patient, I am on the mend, I am recovering, or I am getting well because the doctor is treating me, is curing me, is healing me.
And you recover from an illness. Notice the preposition from, recover from something. Or you could use the phrasal verb to get over. So I've got over my bronchitis. I've got over my cold. To get over something.
Craig, are you familiar with the expression doctor's orders?
Is that when a doctor goes into a pub?
Oh no, I don't. It sounds like a joke. Doctor's orders. Oh,
What are you
I never
ordering?
heard that before. Yeah, because your order in a pub is what you want to drink. Oh, that's good.
No, doctor's orders will be kind of colloquial expression for what the doctor has told you to do in order to get better. So, I've got to stay off the alcohol. I've got to stay away from the beer. Doctor's orders. This is what the doctor has told me I must do. Or I've stopped smoking. Why have you stopped smoking? Doctor's orders.
Another common expression to do with doctors and their knowledge is the expression, the doctor's always right. People say that sometimes in a kind of funny way these days, like particularly if you have a friend who is a doctor, and they say something you disagree with, that person might say, oh, the doctor's always right, as a kind of a joke, saying, I'm a doctor, you can't question me. Or maybe, trust me, I'm a doctor. That's another common one.
Or in the situation with some people in my family who will remain unnamed, just change your doctor until the doctor tells you something that you want to hear.
To get a second opinion.
To get a second opinion.
Or a third, or a fourth, or a fifth.
Yeah. Let's look more specifically for a couple of minutes at Gustavo's questions, because he did mention some particular diseases that we should look at in a little more detail. So AIDS, which in Spanish is SIDA. What do those letters stand for, Reza? AIDS.
Acquired, A. Immune, I. Deficiency, D. Syndrome.
So the fact that there is a deficiency in your immune system means that this particular disease attacks your immune system. So even the slightest cold or slightest illness could really have serious consequences for you.
And another acronym, other letters associated, of course, with AIDS are HIV. It's strange. Notice that we say AIDS as if it was a word. AIDS, AIDS. But HIV we say separately. Mm-hmm. We don't say HIV. We say HIV.
That is interesting. Yeah. I never thought of that before.
Curious, but that's the convention. Mm-hmm. HIV is human immunodeficiency virus. That is what you get first. And then sometimes HIV develops into AIDS, but not always. You can have HIV, but not AIDS. But if you've got AIDS, then you've definitely got HIV.
And I don't think there's any 100% miracle cure for it, but there are treatments and drugs that help reduce its presence in your body. So these drugs will really help your body to fight diseases better.
Another big disease, which of course we've all heard of because it seems to be a worldwide problem these days, is cancer.
Yeah.
Cancer. Who hasn't heard of cancer? You probably, unfortunately, know someone or have heard of someone who's had cancer at some stage. But what can we say about cancer? It's a very wide-ranging disease. It can affect many different people in many different ways.
Yeah, and it's the kind of word that really strikes fear, I think, into a lot of people because they associate it, rightly so in many cases, with painful, inevitable death, and especially of loved ones and friends. It's a very horrible word. I hate it personally. But there are many different types of cancer and a huge combination of different treatments, including surgery with chemotherapy or radiation therapy. There's also immunotherapy, targeted therapy or hormone therapy. So there are many different drugs, medications and treatments depending on the type of cancer that the person's suffering from.
Craig, what do you mean by surgery?
Surgery would be an invasive operation done by a surgeon who is a qualified doctor who can operate on you. And in some cases of cancer, that would involve cutting out a tumor in the body, for example. My dad had a melanoma in his leg, and last year he was operated on. So he had surgery. We use the verb have with surgery. So he had surgery. They operated on him. Notice the preposition on. And they removed the melanoma and they cut out the cancerous tumour, and he seems to be okay.
Now, cancer is something which probably grows, develops quite slowly until eventually it gets diagnosed. But at the other extreme, we have a heart attack. A heart attack, not to be confused with heart disease, which we mentioned earlier. A heart attack is something which happens suddenly. You don't know when it's going to happen. It's just boom, and you got it. But Craig, not all is lost. Craig, there are ways to treat it, right?
Yeah, in fact, my dad's had a heart attack and now he's okay. My sister's had a heart attack and now she's okay. So it doesn't mean it's fatal. And there are different tests and procedures you could have done, preventative treatments, which might help prevent the heart attack. You could have an electrocardiogram, which is often shortened to the 3 letters ECG in English. ECG is a very common test to check your heart.
You could have a more old-fashioned but very effective chest x-ray. Chest is a picture, so an x-ray of your chest, a chest x-ray, or you could simply have some blood tests.
Yes, another more invasive procedure. They say invasive because it kind of invades your body and it's a little bit more uncomfortable sometimes because it could be surgery or involve going inside your body. There's something called a coronary catheterization or angiogram, which involves putting a device into a vein or artery and going to the heart and with a small camera seeing what's going on in that area. And it's amazing to me that they can do these things these days. It really is impressive.
Yes, a catheter, as Craig has described, is something which goes inside you to connect up somewhere. It can go in your vein, or there's another type of catheter which can go in your urinary tract. Best not to think about that, but very painful. Sometimes they have to put a tube in your urinary tract to go into your bowel. That's another type of catheter.
I've had that, and I can definitely say it is bloody painful.
I don't even like thinking about it.
It makes you cross your legs, doesn't it? You can have an exercise stress test in which they get you to run or walk on an exercise machine and then test your heart. And there's another one called a cardiac CT or a cardiac CAT, which is a computerized tomography test.
Yeah, a CT scan, or sometimes they say CAT scan, but CAT seems to be a bit more old-fashioned. You hear CT more these days. And MRI, of course, is very popular these days. It's becoming more and more used. I suppose the equipment used to be very expensive in the past, but now it's more affordable. It's easier for hospitals to buy. MRI, magnetic resonance imaging equipment.
And we don't have time today to go into the particular treatments and symptoms of the other diseases that Gustavo mentioned, but there is a link on the webpage at inglespodcast.com/229, the show notes of this episode, where we have linked to a more extensive vocabulary list on medical vocabulary. So maybe that will be useful for Gustavo and any other people listening who are particularly interested in diseases, health, medicine, etc. So you can go along there and find more information on multiple sclerosis, Parkinson's, Alzheimer's, depression, ALS, which I discovered means amyotrophic lateral sclerosis. Did I say that right?
I think so. Not easy to pronounce, even if you're a native speaker. These terms are not easy. It's the same for Spanish speakers with long Spanish medical words too.
Yeah, if you're not used to saying them, they are quite tricky, quite long words sometimes.
I remember the self-satisfaction, the pride, when I was finally able to pronounce that medical word in Spanish. Otorrinolaryngologo. It really is a word. Have you heard that, Craig?
Well, you've said it before on the podcast, and I'm as impressed today as I was when you said it before. Well done.
The English is an ear, nose, and throat specialist.
So that's Reza practicing his Spanish. Now we want you to practice your English. Now, how could you practice this vocabulary? It's over to you now because it's easy to listen to a podcast. It's quite passive. You know, you're walking the dog or driving your car. You're listening to us. But it's really important that you now try and be active and practice your English. Next podcast, we're going to give you some ways of doing that. But what I would suggest for today is to send us a voice message. Go to speakpipe.com/Ingles podcast and just tell us what you think. Try and practice some of these words and tell us if you have any personal experience of any of the conditions and illnesses and sicknesses that we've mentioned on this podcast. If you prefer to contact us by email, Reza, how can they do that?
You can get in touch with Craig at craig@inglespodcast.com
or Reza at belfastreza@gmail.com. Thank you to all our wonderful patrons who continue to support us on Patreon. All the names of our wonderful Patreon supporters are on the website at inglespodcast.com. Special thanks to Bruno, our gold sponsor, who offers walking tours of Copenhagen through his company, CopenhagenWalkingTour.com. And you can do his tours in English or in Spanish. If you happen to be in Rio de Janeiro in Brazil, Bruno also offers walking tours of the favela district with local guides. It's very safe and it helps the community to improve their daily needs. To find out more information, the Favela Walking Tour can be found at favelawalkingtour.com.br.
If you would like to join our Patreon program, like Bruno, you can do that for as little as $1 a month. You can donate $1 a month to us if you want and get instant access to recent transcriptions. So the words of the audio written out that have been lovingly transcribed by Angelica Bello from Madrid. Just go to www.patreon.com/Inglespodcast.
And many thanks to Beatriz Galasci and Alberto Valverde Conde, who have joined us this month and are our new Patreon supporters. Reza, what's next week?
On next week's episode, when to use never and ever.
Join us next week. Thanks for listening. Until then, it's goodbye from Reza.
And goodbye from Craig.
The music in this podcast is by Pitts. The track is called See You Later.
Oh, one more thing I should mention. As well as listening, it's good to read more about things we talk about, such as health, but be careful. When you Google, when you search on internet, when you surf the web about health conditions, there is the worry that you might make yourself sick. Because have you noticed that if you look at symptoms for diseases, it turns out that most of us have half of them, like slight tiredness, a cough from time to time. Have you noticed that many symptoms could be anything? Please don't make yourself sick with worry if you Google diseases and find you have half the symptoms. It's very, very typical. It doesn't mean you've really got the disease.
Oh, but have you been doing that recently?
No. But I know people who do it and they go, oh, wow, slight tiredness. That means I have fatal lung cancer. No, it just means you're tired.
And please don't start going on to Google and reading web pages and then go to your doctor, your GP, and say, hey, I've been reading the internet and I should be getting this medication and not this medication, because I think doctors really hate that.
Yeah. And please don't go to your doctor and say, I listened to Aprender Inglés con Reza y Craig, and according to what they said, and I've checked on the internet, I immediately need an MRI scan because I may have a fatal cancer. We don't want to get into trouble either.
So once again, we're not doctors. Please don't use this podcast to get extra medical treatment. Anyway, thank you to all our wonderful patrons who are supporting the codcast. The codpaste.
The cod paste.